states. Do you believe, and again, if you don't feel comfortable answering this question, I don't want to put you on the spot, but do you believe that the state of Tennessee is receiving its fair share of allocation of all of these critical therapeutics? And do you believe that there's any sort of, I don't want to call it punishment, but clearly, retribution, something like that? Do you believe, in your estimation, that CMS has been fairly allocating these resources based on need and population of states or cases, as opposed to some other metric? Thank you, Mr. Chairman.
It's a legitimate question, and I'm glad you asked, and I want you to know that I watch that very, very closely, because if there's any indication that we're not getting our fair share, I'll be calling that same day. And to our federal partners' credit, they are being very transparent about what every state gets, and so I can see the breakdown of all of these products for every state. And whereas they don't produce the exact algorithm of how they come up with the calculations, they do generally tie it to both population and disease burden. And when you look at the allocations and how they change week over week, you can see that regardless of whether the state is red or blue, you are starting to see more go to states that have a higher disease burden and vice versa. And so the short answer to your question is no, I haven't identified that, but I'm keeping a close eye.
All right. Thank you. Representative Clemens, you're recognized.
Thank you, Mr. Chairman. Commissioner, what's the total number of COVID-related deaths in Tennessee as of today?
That is a good question. I will look at, it's just north of 20,000. We had 18 and a half or so right before Christmas, and then we had the data dump that we had, which put us just over 20 or 21,000.
So we've had 2,000 about in the last month?
Oh, no, sir. That was a long explanation that we went through in December. I'm happy to send you the media briefing I did on December 22nd. It has a very long explanation of the data lag and the 2,700 deaths that were identified through the Delta surge that were added in late December. But those were from dates of death in July and August.
Okay. I seem to recall that now. Where do we rank nationally in COVID-related deaths per capita?
Last time I looked, we ranked about the same as everywhere in our other metrics, depending on how you do it, low 40s, so 42, 41. This last week, the White House report that came out yesterday, I think we were 42.
So 42 worst or best?
Worst, along with all of the rest of the our southern state counterparts.
Why do you think that is? You kind of say that as a given. Why do you think that is?
Oh, yeah, I do consider that a given. That is where the vaccination rates are the lowest.
Okay. And so you think those vaccination rates are direct correlation to the death rate?
I think there is a direct correlation between vaccination rate and death rate, or lack thereof.
Yeah. So I think last time you were here, you were generous enough to answer this question. So now with the benefit of multiple peaks behind us, multiple variants, almost 2 years of this pandemic behind us and more ahead, unfortunately, what is the department or the administration doing differently now than you were doing early on? And looking forward, what would you do differently? I mean, what have we learned from this, and how has it benefited you, and what practices have you put in place to help our society and state better respond to these pandemics?
Sure. That's a very large question. I'll try to unpack a little bit of it. In some instances, this answer may surprise you. In some instances, I'm not sure a whole lot has changed. That is not to say we haven't learned things or we're not doing things better than we used to. But the same things that we knew worked a year ago work today. And there's really not a whole lot new under the sun. When you're sick, stay at home, wash your hands, get a vaccine. These are not new things, which is, to Representative Byrd's point earlier, your daily action shouldn't change today compared to yesterday or tomorrow if the case count is up or down 200, because the same mitigation measures are the same. I think what we've learned throughout is that physical health is not the single important thing. Economic health, mental health, health and welfare of children and safety of children, there are a lot of things to consider other than physical health. And I think that's something that we've been able to improve over time, and certainly not unique to Tennessee. Across the nation, I think people are seeing that, yeah, we can protect health. And I don't know if you're keeping up with what's happening in, I can't pronounce the name of the province in China, where they are trying to shoot for zero COVID and locking everybody down. There are some very serious and lifelong consequences that come with that. And we certainly were never to that here or anywhere in this nation, but it has illustrated the point of we have to take care of the whole person, and we can't make risk zero. And when you try to make a risk zero, then it's just squeezing the balloon. It pops up somewhere else. And we're seeing that right now, and Dr. McDonald could talk for an hour about the mental health crisis we're seeing in children and in adults, and the drug overdoses, and all of the things that we're seeing. So I think if we've learned anything throughout, we as a nation, as a society, have learned that, yes, this is a serious physical health threat, but it's not the only thing that matters.
Yeah, I appreciate that. And I'm glad you said the mental health. I mean, I'm a big advocate for mental health parity, and I think that we're still battling that front in this state. And I think our state can do a lot better. I won't go on that rant, Mr. Chairman, but that's for another day. But you raise an interesting point about children and their mental health. I've got 3 small children. I watched what happened with different age groups, because I've got 3 different ages, and the impact that it had on them. And I made the point last year in a different committee, I happen to serve on the education committee as well, that we're going to see this for years. Yep. And we've got to address that. I mean, we're going to see the impact of on those children and our students in the schools for years. And, you know, it's another time for another committee about what we should do to address that in our schools. And hopefully that'll be discussed this year. But what do you think, since you raised that point, what do you think is necessary to address those issues for those children who've endured this pandemic?
That's an excellent question, and I don't want Dr. McDonald to feel left out today. So she is a fellow pediatrician and is very well versed in childhood mental health, so I don't want to steal the floor from you, ma'am.
You're not stealing at all. That as well, I mean, I think we could have entire hearings plus some on that, and worlds of literature to kind of go through that. But obviously what you all are doing with the importance of that mental health access immediately in schools, in the community. There's a lot of work going on in pediatricians' offices around identifying those stressors, making early referrals to community-based entities to relieve the stress on parents and home situations, as well as to treat mental health disorders. So, you know, kind of A to Z, looking at your ACEs, which we have lived for the last 2 years for kids, all the way to treatment of conditions. So I think there's a very cross-cutting need there for sure.
I would also add, and I'll acknowledge this may be a hammer and nail situation because I'm a child abuse pediatrician. So I see childhood trauma all the time. And our children as a whole have suffered trauma. And, you know, one of the things that we've learned is home is not always the safest place for some kids. And sometimes they don't eat, and sometimes they're not well supervised, and sometimes they get into things, whether it's substances or firearms or dangerous situations or with dangerous people that they wouldn't have had they been in school. I think one of the things our society has learned more than anything is being in the classroom is paramount to the safety and education of children.
All right, well,
Thank you.
thank you for that. So you just referenced, you see those children all the time, and I assume that's in your other employment capacity, part-time, I guess, employment capacity currently, and ongoing. It's interesting. I hope you will you will come to the K-12 Education Committee and share these same views, both of you, because this is going to be an ongoing discussion this year, and I think it's very important. And then just finally, I think you've already spoken to the vaccination and the importance of vaccination, but I want to ask you a question. I think it's probably got an obvious answer or maybe more detailed than I'm expecting, but to my colleague's point from Chattanooga, is there anything that would assist our state in shifting from pandemic levels to endemic levels faster?
Then vaccination? Oh, I was waiting on the rest of the question. Sorry.
No, it's
Yeah.
vaccination the answer is what I'm getting at.
Yes, sir. Absolutely. Vaccination is the answer.
Thank you.
Thank you.
Thank you, Mr. Chairman.
Thank you. We're coming up on our time here, and we did have a few more questions. But before we go, I did want you to answer some things that wasn't in your slides as far as COVID-19 in the report that came out. Were you guys able to discern any impact that